guys, welcome back to my channel. So today I'm going to be doing a 3-week post-surgery update with you guys about my double jaw surgery and my wisdom teeth removal. So if you're interested in this video, continue watching. If you're new here, welcome. I'm Caitlin. Thank you so much for coming to my channel. I just had surgery, that's why I look like this and I'm talking all funny, so just chillax, watch the video and you'll understand a lot more. But if you are a returner, thank you so much for coming back to my channel, and let's get right into this video. So today I had my 3-week appointment with my doctor and we just went over a lot of things and how I'm doing and what I should be doing and all that good stuff. So I just want to go over with you guys how that went and everything that I've been doing now that I have hit 3 weeks post-surgery. This is usually the turning point for most people during their surgery. Once you hit 3 weeks, you start feeling a lot better. You start returning to do normal things. So I'm really excited I finally hit 3 weeks after surgery because the first 2 weeks were really rough. So going into my 3-week appointment today, I did have a few questions that I wrote down in my phone. So I'm going to go through those questions because I'm sure these will answer some of your questions as well that you guys may have if you're going to be doing surgery of any sort, or just jaw surgery like I did. So I'm just going to go through these questions and answer them with you guys and let you guys know what my surgeon said and how I'm doing currently. My first question, and I'm sure all of you guys are wondering the same thing, is when will my swelling go down? It has been 3 weeks, like I said, today on this day. So I definitely wanted to know, like, hey, when is this swelling gonna go down, because it's been 3 weeks already and I know I had a major surgery and I've come down a lot on the swelling, but I want to know when exactly will the swelling completely be gone. And I was kind of disappointed because he told me today that it's gonna take months and months for all the swelling to go down completely, and I guess I should have expected that with the major surgery that I had. I mean, I had double jaw surgery and also 4 wisdom teeth removed, so I guess I should have expected that. But as of right now, I would say I'm about, I don't even know, 40% swollen. I'm mostly swollen around this area right here and around my chin. The whole area over here is pretty much not swollen anymore. It's just like the lower half of my jaw, and that's the area that's most swollen. But like I said, it is going to take months and months for it to go down, but I should have expected that. My second question was, when am I going to get feeling back in my face? I would say I'm about 45% numb. Well, 35 to 45% numb still. I can feel this side of my face, but I cannot feel my chin at all. I cannot feel my lips mostly, and I cannot feel my left side at all. Like, I mean, I guess if I touch it, I can feel a little bit of pressure, but I can't really feel that much. So I just asked him, like, hey, when is my nerves gonna be coming back? Because like the word person that I am, I usually Google a lot of stuff. And I was looking at that a lot of people who had jaw surgery, sometimes certain nerves don't come back. So I was like super worried, like imagine not being able to feel my left side of my face anymore. But he assured me that that will come back. I just have to do a lot of exercises, like pulling on my face, squinching my nose, just doing a lot of exercises in the face, because that will help me regain nerve feeling in my face. And again, that will take months too, but it will come back eventually. It could take 6 months, it could take a year, but it will come back eventually. So that was just good news to hear. I just have to keep exercising my face. My third question for him was about my braces. So the braces that I have on currently are basically screwed into my gums, and I'm gonna insert a picture. If you're like iffy about that kind of stuff, do not look at this picture. This picture is basically just showing my bottom screw, which is right here below my lip. And this screw, I used to be able to see the head of the screw completely, but then I noticed yesterday that my jaw, well, not my jaw, I mean my gums are growing over the screw. And I was just wondering, like, okay, I know he's supposed to unscrew this when I get my braces off, so how is he gonna do that? Because I saw that my gums were growing over the screw and I was just like, this is really weird, like I don't know if this is normal. So I went in today and I definitely asked him about that. Apparently that's normal, it's just my face healing, and when they do take off the braces, they're just gonna cut around it. Completely normal, nothing dramatic, so I shouldn't be worried about that. My major question was, when do I get my braces off? Because let me tell you, like I said in my last video, if you guys haven't seen that, I'll link it down below. I mentioned that the braces, since they're so low and so high up on my teeth, they're literally cutting into my mouth, and it just hurts so bad. Like when I brush my teeth, I don't even want to go anywhere near them because they are literally ripping the insides of my mouth. So I just wanted to know, when am I getting those braces off? So he told me next Friday, actually, so a week from today I'll be getting my braces off, and I'm super excited because that also means that I'll only have to wear rubber bands at night for 1 more week, and then I'm done with the rubber bands, done with the braces, and that's like another milestone for me, getting past the whole braces thing, because it is tearing my mouth to shreds. Seriously, I'm ready to get them off already. As for pain, he asked me if I was feeling any pain. I'm really not feeling any pain except for the inside of my mouth with the braces, and a certain pain on like the right side of my face, specifically towards my temple. Apparently you have a muscle that goes from your temple to under your cheeks all the way down to your jaw where it connects. And because they were doing a lot of stuff on my jaw, it affected that muscle. So the pain on my right side, like if I barely press it, some days I can really feel the pain. Apparently that's completely normal, and that will go away soon. For some reason, after my surgery, everything on my right side has just been funky. So I try not to sleep on this side, but again, this will go away as time goes by. But I was just worried about that because I had pain on my right side and I didn't on my left. And because it was like up near my temple, I wasn't sure if that had anything to do with my jaw, but apparently it does. So you learn something new every day. As for my energy level, I would say I'm about a 7 out of 10 on a 1 to 10 scale. I'm doing a lot more, getting out there, I'm working again, I'm cooking, you know, I have to eat something. So I would say I'm about a 7 out of 10. But like if I go to the store, I get very tired, or if I have to do a lot of walking or anything, which I haven't really had to do lately. I just had to like sit at my desk at work. But when I have to go to the grocery store, if I'm in there for about an hour, I do get tired. So I just have to start eating better. Right now, I've literally been eating like mac and cheese and whatnot because I'm supposed to eat only soft foods. But again, that's gonna change starting today, I think, was what he told me. But so yeah, I just have to start eating more protein because that protein is gonna give me more energy, and then I'm gonna be hitting a 10 out of 10 on the scale. For food, I can start chewing things like chicken, well, shredded chicken, noodle soup, soft quesadilla, rice, beans, anything like that. Soft consistency, I'm still stuttering, help me. So soft consistency, but I have to stay away from things like really rough meat or hard crackers, things that are just too hard for me to chew. I think at 10 weeks I can start eating actual meat, but as of right now, I'm just gonna stay away from that because I don't want to put too much pressure on my jaw, because then it will get sore and it'll just make the process even longer than it's supposed to be. So I wanted to show you guys how big I can open my mouth. Usually at this point you can stick like 1 finger in your mouth and it should be fine, and then probably in like 2 weeks I can fit 2 fingers in my mouth. But basically I'm just supposed to be like opening and closing my jaw constantly, just so that my jaw will get used to opening bigger and bigger. The surgeon told me that my jaw is gonna feel tight and it's gonna feel like it won't open anymore, but I just have to keep doing the exercises, and the more I do the exercises, the more my jaw will open more. But my current opening of my mouth is this, so that's as much as I can open my mouth. It's kind of pathetic because my teeth are so long, so when I'm trying to eat, like my teeth literally brush the food off my spoon or fork, and it kind of sucks. But I'm working with it, and like he told me, I just have to keep opening up my mouth, and the more I open, the more relaxed my jaw will feel, and that will get better over time. So as for sleeping, I have been able to sleep so much better than the first week of my surgery. The first week of my surgery was horrible. I was getting maybe 3 to 4 hours of sleep every night because like I just couldn't sleep at night. Currently, I would say I'm getting about 6 hours of sleep. I wake up for some reason twice every single night. I wake up at 12 and I wake up at 3 in the morning. And I don't know if it's because I'm just so thirsty or I just feel really puffy, but like I get up, I have like a routine. I get up at like 12 and 3, not because I want to, just because my body wakes me up. I get some water, I rub my cheeks around a little bit because I feel kind of puffy, and I go right back to bed, and that's all I do at night. Like, I just wake up twice and that's it. I'm kind of used to it now. I'm just happy I'm getting more sleep, because the next morning I have to wake up for work, and I don't know what I would do if I wasn't getting any sleep and I had to work too. That would just be miserable. As for the Advil, I know I told you guys in my last video I was taking 2 Advil in the morning, 2 at lunch, and 2 at night. My surgeon told me I no longer have to do that. I just have to take Advil as needed. And yeah, so at the end of the appointment, my surgeon just said I was doing really good. My jaw looked really good, my bite looked really good, my face is coming down with the swelling. So he said everything is looking good so far. Like I said, I get my braces off next Friday, which I'm super excited about. I didn't know it was going to be that soon, so things are going really good for me. The 3-week point, I'm telling you, it was like a turning point in the surgery. So once you hit 3 weeks, you just start doing a lot of normal things. You start feeling way better, and I'm so glad I hit this mark, because I'm ready for my swelling to go down. I'm ready to get back to doing normal things. And yeah, that's basically it for my 3-week post-surgery update. You know, I think I want to do another one maybe at 6 months, and maybe at 1 year, or maybe one at 4 months, just depending on how interested you guys are in these kind of videos. So if you like this video, give it a big thumbs up, subscribe down below so you never miss a video, and comment in the comments down below if you're going to be having surgery, if you've had jaw surgery, what your experience was like, and give some tips, because if anybody's watching this and they're reading the comments, I'm sure they're going to have tips that you guys can share that I didn't share. So definitely share those down below, and I hope you enjoyed this video. Keep coming back to my channel for more videos, and I'm going to continue to post these videos. I'm going to try and post some normal videos. I'm not really sure how I want to do that yet, just because I don't want to post no more normal videos when I'm literally stumbling over my words and I look different and I can't really talk 100% yet. But I'm going to keep continuing trying to post videos every week for you guys. But again, don't forget to subscribe, and I'll see you guys in my next video. Bye.